Hope you are doing well. So just meanwhile, Dr. Rajat is joining the session. So let me give you a brief about MedExam Expert, what we do, and what kind of courses we offer, so that you can have an idea on how to start your AMC journey and how you can ace your AMC journey. So let me just quickly tell you about our courses. So basically, we have launched our Recall Crash course that will be starting from 10th of June. And in the Recall Crash course, we will be covering 10 live sessions. And in the live sessions, we are going to cover all the topics that are important for your AMC journey, like medicine, surgery, pediatrics. Every topic will be covered in these live sessions. And in the live sessions, what we are going to do is we are going to do question discussion. Like we're going to solve all the 2-year important recall questions, and we're going to have a detailed feedback for every question, so that you can have an idea how the AMC gives you questions and how you can approach towards those questions. So apart from the live sessions, we do provide the recording of every live session along with the PDF, so that whenever you are free and if you are unable to join the live session, then you can watch the recording later. Apart from the recordings, we do provide Q banks that contains 5,000 plus questions with correct answers and explanations, so that you can practice more and more. And then apart from Q bank, we have quizzes for every topic that you can attend on the website to have an in-depth knowledge for every topic. Then in the end, we're going to give you 3 mock exams that will be exactly like your AMC exam paper, so that you can practice your, you can have a real-time exam experience with these mock exams. And with the study material, we are going to give you books, notes, flashcards, and all the solved recall files, so that you can practice all the recall questions. After the recall crash course, we have a regular course. In the regular course, we will be covering live sessions in which we are going to discuss about every theory topic, like medicine topics, like surgery topics. Every topic will be covered in the live session. And in the very next day, we're going to provide you the recording and the PDF of the live session. So apart from the live sessions, we are going to provide you the Q bank, so that you can practice 5,000 plus questions with the help of the Q bank. Yeah, Dr. Muhammad Ali. It will be for 2 months. The regular crash course is basically for 2 months. It is a short course in which you can practice, like all the material will be provided to you. Let me just quickly tell you about the recall crash course. Yeah, it is for 2 months, and the starting date is 10th of June. And for the regular course, the duration will be 3.5 months. It is a long course. So all the students out there who are not confident about their preparation and they want to practice the theory, they want the mentors to teach them about the theory, then you can go for the regular course. And in the regular course, like I told you before, that we have added the Q bank, we have added the quizzes, we have added the mock exams that will be just exactly like your real AMC exam paper, so that you can have a real-time exam experience before your actual exams. Because we do understand the psyche of the students, like they have tensions, they have anxiety, before performing for the exam papers. So we have created these mock exams that will, help you out in acing your AMC exam. So before appearing for your actual exam, you can practice these mock exams multiple times to get yourself well prepared before your actual exams. So apart from the mock exams, we're going to give you books, important files that you will be needing for your AMC preparation, all the notes, all the flashcards, and all the solved recall files in PDF forms will be provided to you, so that you can have a knowledge like how AMC gives the questions and you can practice more and more. So let me share some amazing feedbacks from our students who have joined our courses for crash courses, for regular courses, and for exam week sessions. We do offer all these courses. So these are the amazing feedbacks from our beloved students. You can check these feedbacks.
Hello.
Hi, Dr. Rajat.
Yeah,
Yeah.
I'm
So I
sorry.
was just
My
sharing
connection.
the views. Yeah, I was just
Yeah.
sharing the feedbacks with the students so that they can know
Yeah.
how the students have joined your courses and how they have aced the exams.
Yeah.
So,
So see, the thing is, our coaching is like, we. It's not for the profit making. It's about being like recognized as a good teacher and mentors, and they have like chose the best mentors they could have, so that they are all young, enthusiastic, and already working in Australia or are APRA registered, and they are good at what they are doing. So if you guys really want to work, you need new methods, new learning techniques, because if we can crack it, we can help you crack it. So nothing to worry about. So as I told you, there is crash course. If you have less time, your exam is coming nearby in like 3 months or 4 months, you simply take the crash. Am I audible?
yes, Dr. Rajat, you are audible. I guess
Okay.
Dr. Oshi has not joined the audio. I will help her out. You can continue.
To get the AFRA registration, you need AMC-1 at least. If you get a job offer, you can easily get the FR registration. Okay, so if we have the crash course for the students who have their exam nearby, and then we have the regular course for the students who want to start preparing from the scratch. Will help them in getting like letting know get to know the system, like epic verification, ECFMG, AMC-1 preparation, registering for the exam, everything. Like, because we have a team, we don't like, no, I'm not doing everything. It's like we have a team, separate team for this. Like Asma will be coordinating with you guys. If you have any queries, like how to start, where to apply, how to apply for jobs, how to like edit the resume, and she's here there to help. She can connect you with the experts who will be helping you. One of us will be focusing on one thing, other will be focusing on the other thing. Okay, so now I think I'm clear about the our courses, the pathway. And still, if you have any questions, you can ask me in the section. Please be specific in your questions whenever you're asking. I'll straight like answer you straight directly. So ask your questions. Shoot. Yeah, it's a very good question, Mohammed. Mohammed, it depends. Like the course for the AMC-2 is not very vast. Sorry, AMC-1 is not very vast. It's a very limited the syllabus. And if you are dealing with us, we can prioritize your notes, like which is most important or what which is least important. And 3.5 months is enough to give you the proper notes and insights and teaching. So, from the course point of view, 3.5 is more than enough. You need you need not to worry about it. And we want to have like, want you to have 1 month of revision time. Like if we complete the course in 3.5, you need at least 1 month to revise those notes and practice our questions. And yeah, okay. Wait for a second. Okay, so the next question is, uh, will you, after writing MCQ and clinical, their chances are very good because most of the doctors who are applying for the jobs are AMC-1 pass out. And if you have AMC-2, then there are very high chances of you getting a job. After writing, Okay, so I'll just share the slides with you guys again in some time. Uh, yes, it's possible to apply for jobs after AMC-1. What are the requirements for AMC-1 for standard pathway? Uh, Standard pathway, you have to go for Epic verification, ECFMG certification, and then you have to apply for make an account on AMC-1 portal, and you can apply for the exams. It's an online exam, and MCQ you can take from your home country. Dr. Khan. No, we have to get the health insurance till you are on your you are not a permanent green card holder. It depends on your visa. Like sorry, it depends on your CV, like how strong your CV is. Sometimes you get your job offer from your first interview and the first application. Sometimes you apply for hundreds of applications because after getting a job, uh, to get a job after MC1 is really difficult task these days. For AMC1, you have to make sure that you finish it in time and not to panic. Who just completed a bachelor to go to See, if you haven't done your PG from India, you should go for AMC-1 directly and start applying for jobs because it's better to get into the system as soon as possible. I have already done my PG in India. I am in the system right now. But if I would have been in Australia 4 years back, then the things would have been different. But I don't regret anything because right now I have like more grasp on the subject. I did my PG in, so it's no loss. Yes. See, you have to apply for jobs and the hospital sponsor your visa and okay, I'll just show the PPT and let's see how it goes. Okay, Asma, can you please coordinate?
Yes, Dr. Rajat, I can see your screen. Kindly please
Okay,
rotate your device so that we can have a full screen.
wait, I'll just do that. Okay,
Yes, that's
okay,
more better.
okay. So, the previous slides you guys have seen, I
Sir,
was
kindly start with the pathway.
sorry.
Kindly, can you please start with the pathways?
First phase here.
Yes, sir. Yes, from here.
Okay, okay. Now my slides are visible, right?
Yes, it's totally visible.
Okay. So reasons I moved to Australia, I explained, right?
Yes, sir. Kindly, please, can you repeat?
Okay, okay. So Australia, the weather is great, work-life balance is good, they pay you good. Like you have to work for only 38 hours in a week. And if you are working for any weekends or night duties during these 38 hours, you paid almost 1.5 to 2 times for that hour. Like if you are working for 38 hours and there are 10 hours you did on weekends, then you get paid for 48 hours. Okay? Or so it's like that. If you are giving your time on your holiday, they give you good money for that, and they really take care of you. They for like relocation, they give you around $2,500 that is around 1,25,000 Indian rupees for your flights, for your extra luggage, for your transportation. They even provide you accommodation for 1 to 2 months as you are new. And surprisingly, they have given me the cab cards as well, the cab coupons, so that I can easily roam around in Australia in my first month of working. So it's really good. They take care of you. And to become a doctor in Australia, you have to take the AMC-1 exam and English exam at least. And after that, you can start applying for your jobs. And after applying for jobs, if you are lucky enough to get a job and your CV is strong, you will get a job, and then you can easily prepare for MC2 and clear it to get your general registration. So AMC1 is an easy exam with MCQ, but you need proper guidance and a smart study plan to clear it in your first go. So there are three pathways to work in Australia. First of all, the standard pathway I'll be explaining in detail. Second is competent pathway, and third is specialist pathway. The competent pathway is where you are already working in a good countries like UK, New Zealand, US, where you are already working as a doctor. And after working there for 1 year, you can shift to Australia without any exam. And the second one is specialist pathway, in which you are working as a specialist doctor or consultant in your home country. You can apply for specialist pathway, but this pathway is a bit difficult because they compare it with their standards and their students. And if you are not comparable, then they ask you to repeat your residency. If you are partially comparable, then you can repeat your residency for 1 to 2 years. If you are comparable, then you can start working as a consultant, which is rarely the case. So you basically have to repeat your residency in Australia. But I would recommend you to go for standard pathway if you are, even if you are a specialist, because standard pathway there is a good chance you'll get a job, you will progress, and once you have started working in Australia, there are high chances you can get to know the system and compare yourself during working with the peer review thing we'll be explaining later. So sorry. So the standard pathway, the epic verification and English exam. The English exam you can take even after AMC1, but if you are clearing it before that, it's good. But keep in mind that your English exam is valid for only 2 years. So if you can't pass AMC1, or you don't get a job and it takes like 2 years after you clearing your English exam, then you have to repeat that exam. So I would recommend to go for AMC1 first. Once you pass it, it's forever. Then you can easily clear the English exam. And after clearing AMC1 exam, you apply for jobs, get your limited registration, and work for 12 months. And after that, you can go for AMC2 or WBA program, whichever suits you. But I would recommend is AMC2 because it's not that difficult. You can crack it. And for WBA, you have to wait, you have to match. It's expensive, but if you are like scared of MC2 and you can't pass it, you have attempted multiple times, then WBA is justified exam program, where it's a work based assessment. Your consultants will be reviewing your work, and they can say like, okay, he's good enough to exempt from the MC2, and you can get your permanent registration. Okay, after you get your general registration, there is one other program like GP pathway. In GP pathway, what you do is a GP sponsors your visa. They ask they ask you to work for them in their clinic, but for that you have to clear a pesky exam, which is like AMC2 kind of exam. And if you clear it, you have to work in the same clinic for some time under the supervision, and the salary they give you is bit less. Like if you are seeing like 100 patients in a month, then you get paid for the 30 only, because it's like almost 30/70 ratio, because you are working under a GP for, under his supervision. So what he does is he pays you less. But the good thing is you will be working in Australia, you'll be in the system, and after that you can go for the GP pathway and become a GP later on. Competent authority pathway, as I told you, you have to work in the countries like UK, New Zealand, US for some time, and then you can shift to Australia without any exam. But if you are going for this, you have to clear plab 1, plab 2, get a job and work for 1 year. So if you have to clear all these exams, then why don't you directly clear the AMC pathway? Because for Australian exams you have to clear just AMC-1 to get a job. So it's easier. If you are already working in UK, then you can think about it. And the second thing is, if you have moved to UK after MRCP program, then you are not eligible for this pathway, because MRCP is not something they admire the most. So you have to go for the PLAB pathway for this program. And if you are going via the MRCP pathway and you are already in UK after MRCP, you have to complete your subspecialty training and become a consultant there to start working in Australia as a consultant directly. Okay. Hmm. So, as I told you guys, we have two courses. First one is the crash course for 2 months for the students who are having their exam in the coming months. In these crash course, will be teaching you in these 2 months. There will be 10 live sessions, recordings, PDFs, question banks, and the recalls. Will be discussing the recalls and the topics, the most important topics that will be covered again and again. And you will be given the flashcards, recall files, because what we are doing is we are not just giving you the recalls you are getting from the Facebook groups and the WhatsApp groups, because in these groups the recalls you get are like not authentic enough. They are like vague, missing the little details in the question. So we find the exact recall. Even if we don't get it, we just teach the topic, like how it can be framed, how the questions from this topic can be framed, and we like teach you with the best of our knowledge and experience. And the one more important thing is, in this course we provide you with the 3 mock exams. It is very good to be familiar with the exam situation, like how exam will be. So it's like that. And the second course is like regular course. It's for 3.5 months, in which we help you prepare for MC1 from scratch. We'll teach you, make the separate sessions, different sessions by different teachers. We are 4 mentors who will be taking all the lectures and teaching you from like the subjects we like the most, and the most important things, the all the tips and tricks we have, the things we did to crack our exam. So it's like that. And the best thing is, as many of you are here from my Instagram page, that is Dr. underscore Gupta underscore MD, and there I have shared the coupon code, as these are the exam, like the course fees. And on this I'll provide you guys a 20% additional discount if you use my coupon code dr sorry Gupta 20. And you will get the this 20% extra off on these courses, on both the courses. Okay, so it's like Rajat 20 or Gupta 20, or just talk to Asma and tell them like, okay, you are my students, and Asma will help the best she can. Okay, so this is all about the webinar, and now let's just help you guys with the questions. So for the fees and everything, you can contact Esma and our team. They'll help you. All I can do is to get you guys extra 20% discount with the coupon code Rajat20. And if even if you are not satisfied, you can directly message me on my Instagram at dr underscore Gupta underscore MD, and I'll personally attend your messages. Please don't just type hi or hey. Simply tell all your like complete question or your query in my Instagram so that I can answer you in points. Okay. Okay. See, the gap is a problem, but if you have worked for like 1 or 2 months in between, then it's a good thing. Then it doesn't count much. See, you can go for the GP program after AMC-1 in English, but you have to clear the pesky exam, which is for that clinic you will be working in. And for that, you need to get a GP offer. Yes, it's very good to attempt AMC-1 after graduating. Okay, because you are fresh. Yes, we teach theory. Yes, in regular course will help you in theory, recalls, everything. Then it's our responsibility to take care of you from the scratch. Yeah, moratorium is like no, it's not gonna affect Akshay. Moratorium is like you can't open your own private practice for 10 years in cities like Sydney or Perth in good cities. But if you are a consultant and you are in a rural area, then you can open your private practice, so it doesn't affect you much. Specialize in Australia. See, the surgical specialties are a bit difficult to get, but you can easily get the medical specialties. Yeah, obviously, my MD from India is a good plus point for me to get a job, but it hardly matters if your interview is not good, because I have taken like few interviews and I was good at them. I practiced the questions, and I have I have few friends who taught me to like how to who were already working in Australia, and they helped me to crack the interviews as well. And they told me the all the tips and tricks and what type of questions they can ask. And few of the questions were new, but now I'm experienced enough to teach you guys. AMC2 for AMC2 the passing ratio is less. I don't want to give you any false hopes, but yeah, it's very less. Pesky exam is for GP practice, and you can work for any GP after that. It's not that difficult. It's easier as compared to that AMC2 exam. See, 3 years experience is not necessary, but if you are good at interviews and your CV is good, you have published some research paper, you don't even need any experience. You can directly apply for jobs after fresh graduating. Good CV depends on how you like put it. There are some examples on the site, like how your CV should look, and to fill it up, you need to show like your research papers, your publications, your extracurricular activities, everything. You have to sell yourself in those CVs, like okay, why they need us, why they need me. So it's like that. You start applying after AMC1, and meanwhile you prepare for your AMC2 exam. Different hospitals ask different questions in their interviews. Some of them just ask them about us, our goals, long term and short term goals. And some of them will start with the patient scenarios and the questions like a patient came with unconscious status, how will you approach? I have put a video as well, like how to go for A2E approach. I'll teach you guys some other day. Excuse me. Can I apply for private? I don't think you can apply for private hospitals, and moratorium is not what you are thinking, Akshay. Moratorium is you can't open your own practice for 10 years. Visa is sponsored by the hospital. They do all the paperwork and whatever they need, so you don't have to worry much about it. It's not difficult. NEET PG is most difficult. This AMC is like 60%, 50 to 60% difficulty as compared to NEET PG. That is an Indian exam. Does your degree count in CV? It totally depends on the interviewer. Okay, so I guess any other questions? Estimated cost for both exams. See, you can get these details on the site, but I'll just tell you simply like it's around 2 lakhs for MC1 Indian rupees, and for MC2 it's 1.5 lakhs. You can get a job. I have seen many doctors who are working here after MC1 and preparing for MC2. So it's totally upon your CV, your luck, and your confidence. No, it doesn't matter how many attempts you take, and even marks doesn't matter. USMLE is a lengthy exam. It will take around 3 years, and the matching is not sure. So I would suggest you to go for AMC because Australia is a good country. I recently moved here, and I am loving it. Australia giving visas to Pakistan nationals for AMC two. I will have to check it with the team because these days AMC2 exam been online, so you can get the exam from your countries. Like I don't know about the Pakistan, but from India you can take the exam online. Does post or in private also do count? Should be rating? No, every experience counts. Advanced question can be immediately applied for once seems to pass. You have to get a job for applying for your registration. There are multiple exam centers. You don't have to worry about it. Once you get the slot for AMC1 or AMC2, you can take it from Chandigarh in Delhi, and different countries have different exam centers, but it's easily accessible. If you are preparing, John Murthak is a reference book. You have to clear your doubts from there. You can't read it, and if you read it, you can't remember it. So this will be too much. What you need is the crisp of these handbook and John Murtagh book. So you need the notes. I didn't have any visa issue. The hospital sponsored it. So here I am. Can be granted visa to come and do the IMC in Australia. We'll have to check it with the team. Whether you'll get visa for MC1 in Australia. Every month have MC. Yeah, but the slots open and they fill very fast because these days the competition is getting really high and many students are applying for AMC exam. Can online AMC2 be done online from? Ah, mostly. There are many centers in different cities and different countries. Should experience be in medicine, ICN? Mm, should experience be in medicine, ICN emergency only? No, your experience can be in any department, any branch. You just have to work. Yeah. Okay. Yeah. You can go for IELTS, OT, OET, and PT. Anything you can go for. So yeah, we'll provide you the study material for AMC1. And from Nepal, our team will answer that because they'll have to check your country for like AMC1. It will take to get PR in Australia 1 year. After 1 year, you can apply for PR of your after 1 year of working, and once you get your permanent registration, you can apply for PR. What's the pathway after passing AMC-1? How long to become a specialist when you start working? Is there an AMC center in Qatar? See, after AMC-1 and OET, you can apply for jobs. And once you get the job, within 1 year, you can apply for your medicine training. So it totally depends, like how and when you are applying. Can I apply for PR after AMC-1? No, you have to work here, get your general registration, then you can apply for PR. You have to get the permanent registration for applying for PR. The job situation as bad in Australia as NHS? No. In Australia, there are lots of vacancies, but you have to be a deserving candidate because the competition is gonna be high real soon. Right now, it's good. You can come here, work here, and it will be okay. Okay, how to start from scratch? You have to read the notes and do the recalls and repeat the questions. You just get the notes, read them, read the notes again and again, and then start preparing for your AMC questions and practice the questions. I have posted we have posted my previous webinar on the YouTube channel, and I'll be also doing a live session on my Instagram channel, that is dr_gupta_md, real soon, to teach you guys how to prepare for AMC one, and like how to start from scratch. See, if your partner is in Australia, then it doesn't affect your job. But if your partner is having a PR, then you can get the PR as well after getting married to her. For visas, our team will be helping you. You just connect with Asma. She'll connect you with the specialist. Is the general registration equivalent to general physician, family physician? No, general registration is you are a registered doctor in Australia. After that, you have to go for GP training or the medicine training, BPT we call it, and so on. If you are joining the course, then the recalls will provide. Otherwise, there are many Facebook and WhatsApp groups, but the recalls you get there are broken, like they are not complete. Yeah, they allow everyone. CKF, it totally depends how prepared you are, because for AMC2, you need to have the knowledge of AMC1 as well, because there is some theory and more of like speaking. So if you have the AMC1 knowledge, you sit in the exam within like 6 months or 5 months. It depends, totally depends on your confidence. There is no time limit, I guess. If you clear AMC2, you get your registration, general registration. You don't need to go for residency to get your general registration. So I think that's all for today. Even if you have any other doubts regarding your visa and for your visa and any job for like interviews and resume, you can connect with Esma. She'll direct you to our team and help you go get more insight about it. And that's it. All. I hope it this webinar helps you guys. And if any of your friend is also preparing for Australia or thinking about going to Australia after doing his or her MBBS, please share this webinar with her, and let's see how many doctors we can help with these webinars. And even if you like move or not, you should know how the system works in different countries, because after working in India, my duties during my residency used to be like 36 hours straight without sleeping, and all the time in ICU wards, running here and there. But here I have to work for 38 hours in a week, and that too I'm getting good money out of it. So think twice before joining PG. in your home country. Look at the competition, look at the working hours, and the toxicities in some colleges is very bad. So make your decisions wisely. I'm not saying I'm not saying you move to a different country, but you can consider it always because of everything. Okay. And somebody asked about the salaries. I'll tell you, it's around like, I'll tell you in Indian rupees because I'm Indian and I think in Indian rupees. So it's starting from 3 lakh to 5 lakhs. It depends on the job you get, the level you enter in. So the starting salary will be around 3 lakh Indian rupees if you work 38 hours a week, that too without any doing any night duties, without doing any weekends. So if you do all this, then the salary is a bit higher. So all the best. Bye. Okay, Asma.
Yes, yes. Thank you so much all for joining us for today. We have shared our numbers and our links for the WhatsApp. We have Charlene, we have Sumaya. We all are here for your guidance. So we do provide free guidance. So do contact us so that we can guide you in your AMC journey.
And if you guys are planning to join